Oftentimes when patients start with oral appliance therapy, some questions they have are, is my bite going to change? And while that rarely happens at our office, it is a possibility. It usually comes down to three things. And so I'll go over those right now. Now, our bite, we're very hypersensitive to that because of the proprioception that our bite has. And what I mean by that is if you ever got a popcorn kernel stuck in between your teeth, it feels huge, and then you get it out and you look at it, it's actually quite tiny. So our ability to sense what's going on inside the mouth is great, and it's needed so because chewing, eating is such a huge part of our normal day and our function and our livelihood. So we have a lot of brain power devoted to those areas. And that's why a lot of TMJ problems, bite problems can be an issue for patients. So with that, kind of the first bite change that we can see with oral appliance therapy or orthotics is if the cartilage is out of place. So if the cartilage is out of place, that's usually what causes patients to have a lot of pain. So if cartilage has a set thickness, our goal oftentimes is to get the cartilage back into place. So if we get the cartilage back into place with appliance therapy, injections, or whatever we may use, the bite will feel off. And that's actually a good thing because we'll have a normal orthopedically stable jaw joint, bite that may be off a little bit, and we can always work towards correcting that if it becomes a problem with the patient. So sometimes patients will have an appliance where the disc is in place at night and they take it out and it starts to click and pop. And so those are things we can work through with patients. The second reason we may see a bite change has to do with biting forces. So if we have an appliance and then we're biting down so hard that we're actually moving the teeth, even with the appliance in place, then that's an issue that we'll need to discuss in terms of how do we control the heavy clenching, grinding forces that are going on at nighttime that are so great that they're pushing on the appliance and kind of changing the bite a little bit. And then the third thing that we can see is if we have an appliance that's preventing your jaw from sagging back, the muscles are being held in a different position all night long. So when you get up in the morning, the bite might feel a little funny. Maybe the back teeth don't touch all the way, or maybe the bite feels a little forward. And those are all reasonable things that can happen. Picture if you wake up in the morning, you can't touch your toes right away, but after you get loose and stretch out, you can touch them. Same thing sometimes happens with the bite where it feels off, but by the time you get out of the shower, it goes back to normal. Any of these instances, if they occur, we'll always discuss them and we'll try to be proactive in telling you what to anticipate on the front end. But ultimately, we just have to make sure that the benefits outweigh the risks. We got to make sure that any progress, improvement that we get, if the bite changes a little bit, is it acceptable? Is it fixable? Do we need to fix it? And then what are the next steps? So we'll always have open commentary about it, but hopefully this video explains some of those scenarios in a broad sense. And as always, if you have questions, please reach out to us and we look forward to answering them.